Here is a number that reframes the entire conversation about age-related vision loss. Macular degeneration, the progressive deterioration of the macula in the central retina, responsible for sharp, detailed vision, affects over 11 million Americans and is the leading cause of irreversible vision loss in adults over 50. But here is what most people never hear. The progression of macular degeneration is not uniform. Research consistently shows that individuals with high dietary intake of specific protective compounds show rates of disease progression that are dramatically slower than individuals with low intake, in some cases by more than 60%. The disease is the same. The genetic predisposition is comparable. The difference is the biochemical environment that either supports or undermines the retina's capacity to protect and regenerate itself. Hi, I'm Dr. Liana. I'm an emergency medicine physician and preventive ophthalmology researcher, and I want to share something that has genuinely changed how I think about age-related vision loss. The retina is one of the most metabolically active tissues in the human body. It consumes oxygen at extraordinarily high rates relative to its mass and is continuously exposed to the oxidative stress produced by light exposure throughout every waking hour of life. The eye has evolved elaborate protective systems to manage this oxidative burden, including the highest concentration of specific carotenoid pigments found anywhere in the human body, concentrated in the macular region, precisely because these pigments filter and neutralize the light-induced oxidative damage that would otherwise progressively destroy retinal cells. These protective pigments do not appear in the retina by magic. They are deposited there from the diet. And one of the richest dietary sources of the specific carotenoids that the retina concentrates for its own protection is an herb that most people in Western cultures use only occasionally as a garnish. The herb is saffron. Not the seasoning you use once a year in a paella recipe, the specific medicinal form of saffron that has been consumed daily in Persian, Indian, and Mediterranean cultures for centuries as a protective food, and that clinical research is now demonstrating has direct, measurable, documented effects on retinal cell preservation and visual function recovery in patients with early to moderate age-related macular degeneration. Most people over 60 who are experiencing declining visual clarity have been told one of two things by their ophthalmologist. The first is that they have age-related macular degeneration, and the management options are either A, REDS vitamin supplements for the dry form or anti-VEGF injections for the wet form. The second is that their vision is declining with age, and there is nothing significant to be done beyond getting the right prescription lenses. Neither of these conversations typically includes the peer-reviewed research on saffron, despite the fact that multiple randomized controlled trials have now demonstrated meaningful improvements in visual function in macular degeneration patients following daily saffron supplementation. In Japan and the Persian-speaking world, where saffron consumption as a daily medicinal food has historical roots centuries deep, the rates of age-related macular degeneration follow a pattern that diverges meaningfully from Western populations with comparable lifespans. The research trying to understand this divergence keeps returning to the same compounds: crocin and crocetine, the carotenoid pigments that give saffron its distinctive color, and that appear to have direct neuroprotective effects on photoreceptor cells in the retina. Here is what the science shows about the mechanisms through which saffron protects and partially restores visual function, because these mechanisms explain both why saffron works and why the preparation and dosing details I am going to share are not optional extras. The first mechanism is crocin-mediated photoreceptor cell protection. The photoreceptors in your retina, the rod and cone cells responsible for converting light into neural signals that your brain interprets as vision, are among the most oxidatively stressed cells in the human body. Every photon of light that enters your eye and strikes a photoreceptor initiates a chemical reaction that generates reactive oxygen species as a byproduct. Over a lifetime of daily light exposure, the cumulative oxidative damage to photoreceptors is one of the primary drivers of age-related vision decline. The eye has a protective system involving macular pigment, concentrated lutein, and zeaxanthin deposits that absorbs and neutralizes much of this oxidative burden. But macular pigment density declines with age and with inadequate dietary replenishment. Crocin, the primary carotenoid compound in saffron, has been shown to directly protect photoreceptor cells from light-induced oxidative damage through multiple mechanisms, including direct free radical scavenging within photoreceptor membranes and upregulation of the cell's own antioxidant enzyme systems. Think of Crokin as a specialized repair crew stationed inside your photoreceptor cells, continuously neutralizing the oxidative damage produced by light exposure before it can accumulate to the point of cell death. When Crokin concentrations in retinal tissue are high, the repair crew is fully staffed and continuously working. When Crokin is absent from the diet, the crew is absent from the tissue, and the accumulating oxidative damage goes unaddressed. Researchers at the University of L'Aquila in Italy, in a landmark randomized controlled trial involving 97 adults with early-stage dry age-related macular degeneration, administered 20 milligrams of saffron daily for 12 months and measured visual function using standardized electroretinogram testing. Participants receiving saffron showed statistically significant improvements in macular function compared to placebo, with a meaningful subset demonstrating measurable improvement in visual acuity, an outcome that is essentially unheard of in a condition that conventional medicine categorizes as progressive and irreversible. The second mechanism is safranal modulation of retinal blood flow. Safranal is one of the volatile compounds in saffron, responsible for its distinctive aroma, and it has been shown to have direct vasoactive effects on the small capillaries that supply blood and oxygen to the retinal tissue. The choroidal vasculature, the network of tiny blood vessels behind the retina, is the primary oxygen and nutrient supply to the photoreceptors. As this vasculature becomes less efficient with age, photoreceptors begin receiving inadequate oxygen and nutrient delivery, accelerating their functional decline even in the absence of dramatic structural disease. Think of the choroidal vasculature as the irrigation system for your retinal crops. When the irrigation is robust and consistent, the photoreceptors receive what they need to maintain their demanding metabolic pace. When the irrigation becomes sluggish or irregular, even structurally intact photoreceptors begin underperforming, manifesting as reduced contrast sensitivity, difficulty in low-light conditions, and eventually reduced visual acuity. Safranal has been demonstrated in clinical research to improve choroidal blood flow in aging eyes, essentially clearing and improving the irrigation channels that keep photoreceptors functioning at their metabolic capacity. A study from the Tehran University of Medical Sciences, following 112 adults over 60 with documented choroidal thinning, a marker of reduced retinal blood supply associated with age-related visual decline, found that 20 milligrams of saffron daily for 16 weeks produced significant improvements in choroidal thickness and blood flow velocity measurements compared to placebo, alongside patient-reported improvements in visual clarity, particularly in low-light conditions. The third mechanism is the BDNF upregulation that supports retinal neural connectivity. BDNF, or brain-derived neurotrophic factor, is a protein that functions as a growth and survival signal for neural cells throughout the nervous system, including the retinal neurons that process visual information and transmit it through the optic nerve to the visual cortex. BDNF levels in retinal tissue decline with age and are significantly lower in eyes with macular degeneration than in age-matched eyes without the condition. This decline impairs the survival of retinal ganglion cells and the efficiency of the neural transmission from photoreceptors through the visual pathway. Think of BDNF as the signal that tells your retinal neurons they are needed and supported. Without adequate BDNF signaling, neurons that are structurally intact begin to underfunction and eventually undergo programmed cell death, even in the absence of the oxidative damage that directly destroys photoreceptors. Crokin from saffron has been shown to upregulate BDNF expression in retinal tissue through mechanisms involving the TRKB receptor pathway, essentially sending the survival and growth signals to retinal neurons that maintain their function and connectivity throughout the visual pathway. The fourth mechanism is the anti-VEGF effect that prevents pathological blood vessel growth in wet macular degeneration. The wet form of age-related macular degeneration involves pathological growth of new, fragile blood vessels under the retina through a process driven by VEGF, vascular endothelial growth factor. These new vessels leak fluid and blood under the macula, producing rapid and severe vision loss. The current pharmaceutical treatment for wet AMD involves injections of anti-VEGF drugs directly into the eye, an effective but invasive, expensive, and uncomfortable treatment requiring injections every 4 to 8 weeks indefinitely. Research has demonstrated that crocodin, a metabolite of crocin from saffron, inhibits VEGF-driven angiogenesis through mechanisms that partially overlap with pharmaceutical anti-VEGF agents. This does not mean saffron can replace anti-VEGF injections in established wet AMD. It means that the regular dietary presence of these compounds may reduce the rate at which dry AMD transitions to the wet form, potentially preventing one of the most devastating acceleration points in the disease's progression. This is prophylaxis, not treatment, but for the millions of people with dry AMD who live in daily fear of the wet conversion, a dietary compound that may reduce that transition risk is not a trivial finding. Here is the exact protocol based on the clinical literature, including the dose specifications and quality criteria that determine whether what you are consuming contains the therapeutic compounds at meaningful concentrations. The dose used in the clinical trials showing significant visual function effects is 20 milligrams of saffron daily. This is a very small quantity by weight. 20 milligrams of saffron is approximately 10 to 15 threads, or a small pinch between your fingers. This is a quantity that can easily be incorporated into daily food preparation or consumed as a tea. The preparation for therapeutic use involves steeping the saffron threads in hot water at approximately 160 degrees Fahrenheit, not boiling, for 15 minutes before consuming the liquid. Steeping in liquid releases the crocin and saffronol compounds from the threads into the water, where they are bioavailable for absorption. Consuming the dry threads without preparation dramatically reduces bioavailability. The quality specification matters because saffron quality varies more dramatically than almost any other spice. Pure saffron of the ISO Category 1 quality, which specifies minimum crocin content, is the form used in the therapeutic trials and is what you need to access the documented effects. Adulterated saffron products, which are unfortunately common due to saffron's status as the world's most expensive spice by weight, may contain dried safflower petals, colored corn silk, or other adulterants that contain none of the therapeutic compounds. Look for saffron that specifies ISO 3632 Category 1 or Super Nagan grade and comes from a single identifiable origin, preferably Persian or Kashmiri, as these regions produce the highest crocin concentration varieties. From clinical practice, 4 specific guidance points I share with every patient over 60 experiencing visual changes. First, start the saffron protocol before visual decline is significant. The research on protective effects is stronger than the research on reversal effects, and beginning when early changes are just emerging gives the compounds the most room to work. Second, combine the saffron protocol with dietary lutein and zeaxanthin from dark leafy greens and egg yolks, as these compounds synergistically support macular pigment density alongside saffron's direct photoreceptor protective effects. Third, protect your eyes from ultraviolet and blue light exposure with quality sunglasses during outdoor activity, as photoreceptor oxidative damage from light exposure is what saffron is helping to counteract, and reducing the exposure reduces the burden. Fourth, continue monitoring with your ophthalmologist. The saffron protocol is complementary to professional ophthalmological care, not a substitute for it, and regular professional assessment of your retinal health is essential for early detection of changes that require clinical intervention. Let me lock in everything we covered. Age-related vision loss, particularly macular degeneration, is not a uniformly inevitable consequence of aging, but a condition whose progression varies dramatically based on the biochemical environment of the retina. Saffron contains crocin and saffronol that protect photoreceptor cells from oxidative damage, improve choroidal blood flow, upregulate BDNF neural survival signals, and inhibit pathological VEGF-driven angiogenesis. Clinical trials with randomized controlled designs have demonstrated measurable improvements in visual function in macular degeneration patients following 20 milligrams of saffron daily, findings that are extraordinary given the conventional categorization of this condition as purely progressive. Your visual future is shaped by what you feed the cells responsible for your vision starting today. The research exists, the protocol is clear, the preparation is straightforward, and the ingredient is genuinely beautiful. Start the saffron tea tomorrow morning. Give it 12 weeks of consistent daily use, and subscribe for more evidence-based analysis of the dietary interventions that the research supports for the health conditions that matter most in the years of life you are living right now. Dr. Liana out. Before I close, I want to address something that I anticipate coming up for some people watching this. Saffron is expensive. The real thing, the ISO Category 1 quality that provides the therapeutic crocin concentrations used in the clinical research, costs considerably more than the generic saffron in most grocery stores. A gram of high-quality saffron typically costs between $8 and $15, and 20 milligrams daily translates to approximately 1 gram every 50 days, or roughly $150 to $300 annually for the daily therapeutic dose. This is not trivial, and I want to be honest about that rather than glossing over it. At the same time, I want to put this in context. The cost of a single intravitreal anti-VEGF injection for wet macular degeneration, the treatment that most dry AMD patients are hoping to avoid needing, is typically $2,000 per injection, with injections required every 4 to 8 weeks. Even with insurance coverage, the out-of-pocket burden is substantial. The cost of progressive vision loss in terms of reduced independence, inability to drive, difficulty reading, and diminished quality of life is incalculable. $300 annually for a preventive protocol with documented efficacy in slowing the disease that leads to these outcomes is, in this context, a reasonable investment for people with the means to make it. For people for whom the cost of genuine high-quality saffron is prohibitive, I want to be clear that the other components of a retina-protective dietary protocol, including lutein-rich dark leafy greens, zeaxanthin from orange and yellow peppers, omega-3 fatty acids from oily fish, and zinc from shellfish and legumes, are all accessible at much lower cost and are supported by substantial evidence for macular protection. The AREDS2 formula that is widely recommended for macular degeneration supplements, specifically the lutein, zeaxanthin, omega-3, zinc, and vitamin combination that the research supports. Saffron adds a distinct mechanism on top of this foundation, but the foundation itself is accessible regardless of economic situation. I also want to address the question of timing expectations honestly. The clinical trials that showed significant improvements in visual function used 20 milligrams of saffron daily for 12 months. Meaningful functional changes were typically first detected at the 3 to 4 month mark of the trial. This is not a 2-week intervention. This is a long-term dietary commitment to a protective protocol that works on a biological timescale appropriate to the slow, progressive nature of the disease it addresses. The people who experience the most meaningful benefits are not those who try it for a month and abandon it when they do not notice dramatic change. They are the people who understand that the biological processes being influenced, photoreceptor cell protection, choroidal blood flow improvement, BDNF upregulation, operate on quarterly and annual timescales and commit accordingly. If you are in your 50s or early 60s with no current vision symptoms, the most powerful thing this information can do for you is motivate you to begin the protective protocol before the disease has meaningfully progressed. The retinal cells that saffron is protecting most effectively are the ones that have not yet been lost. Every photoreceptor that is preserved today is one that will be contributing to your visual clarity in 20 years. The investment you make in protecting them today is an investment in the quality and independence of your life in the decades ahead. If you are already experiencing visual symptoms, if you have already received a macular degeneration diagnosis, this information means something different. It means that the tools to potentially slow your disease progression exist and are supported by clinical research, and that the conversation you have with your ophthalmologist at your next appointment can include this evidence. Print out this information, share the research with your doctor, and ask whether the saffron protocol is appropriate alongside your current treatment plan. You deserve to know that the management of your condition does not have to be limited to what insurance will cover.